Hey everyone, Daniela here with Addo Aesthetics, and I'm going to talk you through a clear and brilliant treatment that I recently performed at Healy Plastic Surgery. I'm starting off the clear and brilliant treatment by removing the BLT cream that I applied 20 to 25 minutes ago by wiping off the excess, cleansing the patient's skin, and then degreasing with alcohol. Once that's complete, I'll apply the patient's goggles as well as my own. The Clear and Brilliant is a non-ablative fractional laser with two handpiece options. The classic handpiece is a 1440 and the Permea is a 1927. Both are targeting water in the skin, which makes it safe for all skin types. If you're familiar with Fraxel, it's the same concept, only with significantly lower energy delivered. In fact, the same company that makes Clear and Brilliant also makes the Fraxel, so think of it as a baby Fraxel. Once my patient and I are prepped and have our goggles on, I'll begin working on sections of my patient's face, beginning with the forehead and working my way down in a systematic pattern. In each section, I start off with two vertical passes directly over one another, moving across that particular section of skin that I'm working on. Once that's complete, I go over the same area of skin, again performing two passes, one over the other, only this time I'm moving in a horizontal direction. Now for our patient, Amy, we're doing a very light treatment. We're using the classic handpiece on medium, and we're doing 4 passes total. She's got beautiful skin, and this treatment is really being performed for preventative maintenance. If Amy were concerned with pigmentation, we'd be using the Permea handpiece and would adjust the settings, which are already preset to choices of low, medium, and high. We can also adjust the number of passes that we're doing in each area of the face. So if I did decide that I wanted to do more passes, I would just continue to do one over the other, but I would go in a different direction than the previous passes to ensure that I'm getting greater coverage. You'll also notice that as I complete each section of the face, I stop to apply a product on that section of skin that I've just finished treating. I'm using the CE4 Rulik by Skinceuticals. So Skinceuticals and Solta, who's the maker of the Clear and Brilliant laser, they did a study together. And they found that when you apply the CE4 Rulik immediately after you've completed a section of skin, and that's important that you do it immediately after because those channels close up very quickly, your patient will have a better result. Once we've finished the service, our protocol here at Healy Plastic Surgery is to continue to use Skinceuticals products. So I've used the epidermal repair, which is a great moisturizer for post-procedure skin. And I finished with the Physical Fusion SPF 50, which is a broad spectrum, pure physical block that's chemical-free and paraben-free. Your patient is going to be pink right after the treatment, and that can last anywhere from a few hours all the way up to 24 hours. The following day, and for 3 to 5 days post-treatment, the patient will have kind of a sandpaper-like texture to their skin. This is going to naturally slough off over time, and it's important to remind our patients not to use scrubs, Clarisonics, or any exfoliating products. I send my patients home with the Dermal Repair Cream by Sente and the Physical Fusion by Skinceuticals. If your patient is a Retin-A user, advise them to begin use once again 1 week post-treatment. Same thing's true if they're using a hydroquinone or any other kind of skin lightener. Clear and Brilliant treatments, they can be done on a monthly basis for general maintenance, but I typically recommend them in a series of 3 to 6 treatments that are received in 3 to 5 week intervals. It really just depends on the need of your patient. If you also happen to have a hydrofacial machine, I love having a patient come in 1 week post-treatment for a hydrofacial, which really is like the cherry on the cake. The hydrofacial helps plump and hydrate the skin, and the combination of the hydrofacial with the Clear and Brilliant treatment just leaves the patient with smooth, hydrated, and really bright skin. So I hope you enjoyed this video on how we do the Clear and Brilliant treatment at Healy Plastic Surgery. And remember, this is not meant to be a training on how to perform the treatment, but rather offer you some inspiration and education on the Clear and Brilliant. Thank you so much for watching. If you have anything that you'd like to add on how you do the Clear and Brilliant at your practice, please leave a comment below.